Whooping cough outbreak. Pertussis is a respiratory disease caused by the bacterium Bordetella pertussis. It is highly contagious and responsible for an annual 18 million illnesses and 250,000 deaths worldwide. Globally, pertussis is one of the leading causes of death for children under 5 years old. Pertussis outbreaks can be difficult to identify and manage. Whooping cough spreads through close contact with oral secretions or respiratory droplets. Because of this, it is easily spread through coughing, especially when people are in close contact, like living in the same house with a person who has whooping cough. It can also be spread through sneezes and anything that spreads respiratory secretions. The community will be advised through email, radio, television of the symptoms and instructed to seek health care at designated areas if exposed or shown signs of symptoms. Respiratory masks will be given at the entrance of all hospitals and to all hospital staff. Quarantine processes will need to be implemented to restrict the movement of well persons who may have been exposed to an infectious disease, or they may have the disease and are not yet showing symptoms. Isolation practices used will restrict the movement of people who are ill by separating them from those who are healthy. The following isolation quarantine requirements will be followed. Isolation non-hospitalized patients if voluntary. Hospitals should follow droplet precautions for 5 days of appropriate antibiotic therapy, if not treated, until 20 days after the onset of symptoms. Quarantine. Susceptible contact should maintain out of school or child care settings until 21 days after their last exposure or until the case and contacts have been received. 5 days of appropriate antibiotics with pertussis should remain out of school or child care settings until they have received 5 days of appropriate antibiotic therapy, or, if not treated, until 21 days after the onset of symptoms. Voluntary isolation from works and other settings where close contacts may transmit the disease is desirable, but such restriction of activity would be very difficult to legally enforce. Each department will be cross-trained immediately regarding the recovery, treatment, and discharge process for the infected patients. This will create a unified approach to treating the outbreak. Public health officials actively screen for symptomatic patients with the suspected pertussis outbreaks in settings such as schools, daycare centers, and hospitals. Active screening for such suspected cases potentially reduces the exposure to people with pertussis, encourages timely medical evaluation and treatment of cases, promotes prompt admission of antibiotics to high-risk close contacts. Early treatment of pertussis is really important. The earlier a person, such as an infant, starts the treatment, the better. Healthcare professionals commonly use polymerase chain reaction PCR tests to diagnose pertussis. PCR tests vary in their ability to correctly show who does not have pertussis. Whooping cough is a bacterial infection, so it can be treated with antibiotics, usually erythromycin or a family of antibiotics like erythromycin. Erythromycin is taken for 2 weeks. A vaccination program will be implemented for all who have been vaccinated at the site, separate from the already infected patients. Because younger children, non-vaccinated persons, and elderly are at the most at risk, a team will visit the elementary schools, daycare facilities, secondary schools, and nursing homes. Second, for all others, a designated location and team of healthcare professionals will administer the vaccinations. Post-exposure antimicrobial prophylaxis should be implemented. The primary objective of PEP is to prevent death and serious complications from pertussis in individuals at increased risk of severe disease. Providing PEP to high-risk people within 21 days of exposure to infectious pertussis-caused patient. High-risk people are those who personally are at high risk of developing severe illnesses, or those who have close contact with people at high risk of severe illness. High-risk people include infants and women in their 3rd trimester of pregnancy. Some severe and sometimes fatal pertussis-related complications occur in infants under 12 months, especially infants under 4 months, and women in their 3rd trimester of pregnancy can be a source of pertussis to their newborn infant. All people with pre-existing health conditions may be exuberated by a pertussis infection. People who themselves have close contact with either infants under 12 months, pregnant women, or individuals with pre-existing health conditions at risk of severe illnesses or complications. Leadership styles play an integral role in enhancing the quality improvement in healthcare. Impact on health-related outcomes differs according to different leadership styles. Leadership has been recognized as a major indicator for developing qualitative organizational culture and effective performance in healthcare. Transformational leadership style is characterized by creating relationships and motivation among staff members. This leadership increases nursing unit organization and structural empowerment. This has an impact on an organizational commitment for nurses and, in return, higher levels of job satisfaction, higher productivity, nursing retention, patient safety, and overall safety climate and positive outcomes. Because of extra manpower needed to contain and control whooping cough outbreak, efficient, consistent protocol will need to be followed. Upon arrival at treatment facilities, all staff will receive the same training of our protocol by the assigned leadership personnel to ensure successful outcome. Surrounding areas will be contacted to request antibiotics vaccination and trained healthcare professionals that could aid in treatment. Activities must be implemented include identification and registration of vaccine providers, distribution and tracking of vaccine administration through these providers, identification and hiring of additional staff needed to conduct the statewide vaccine campaign, and additional tasks to implement population-specific campaigns if needed to assist in the vaccination procedures for healthcare employees. Implementation of school-located vaccination clinics require establishing procedures for school nurses as partners and addressing the training needed to incorporate the use of volunteers in vaccine distribution program. Hospital staff will be trained in areas such as vaccine administration and hospital admission. The pharmacy will need extra staffing and training to streamline the processing of prescriptions so those infected can receive antibiotics needed in a timely manner. My recommendation is to follow this plan for a smooth, quick containment and treatment of whooping cough. This plan should be used for any future outbreaks. Staff training should be once a year to know the proper procedures and roles of the different healthcare staff and departments. By doing so, the response time will be timely because the training will have been done. Designated leaders should be assigned over the training process and also when an outbreak occurs. Continuous vaccine campaigns will prevent or lessen a future outbreak.